We're back with our conversation on fentanyl here in Central Illinois. We're going to touch back on MAT training, which is something we brought up so far. So, Sheriff Watkins, tell us a little bit about that briefly and what it is and how it works.
Yeah, we recently just started it. We got approved for a grant. So now, like I said earlier, we have a lot of highly addicted individuals that come in our jail. I would like to try to treat them as much as possible while we have our hands on them. So we treat them with Suboxone. We find out what they're addicted to. And then there's other medications that we can provide also. But then also we give them a recovery pathway when they do get released. They have to choose to do that, but we definitely want to at least provide that for them because it will save lives and it will reduce crime in Peoria County.
Absolutely. And when you talk about, giving them an option to move forward, you're also providing a resource in a sense, right? So ways people can turn for help. So what other resources are in the community at play that people can look for support if they should want help?
Yeah, so just in the last year, Joel has we started a peer recovery program, and we have a recovery cafe. So this is a place where people are looking for sober social activities. They can come, they can participate in groups and classes and engage in just fun social activities, but they can also access peer recovery navigators. These are people with lived experience who have overcome their substance use challenges, and now they're walking alongside other people, helping them navigate that same challenge.
And that has to bring a level of respect, too, between the people who are interacting and a level of trust as well, which is important. So what's being done here in Central Illinois to actually lower the amount of fentanyl deaths?
I think everything that's happening right now, I really credit Chris's efforts at the jail. Historically, we have seen people discharged from the jail that later overdose because their thresholds are lower for that. So that's huge. The fentanyl test strips, huge. The efforts through harm reduction at Jolt and the widespread community efforts are saving lives. We see it in our data. Year after year, we see it in our data where we have reduction of overdose deaths, particularly with opioids and fentanyl. It's working.
Pre-COVID, the health department did a study, and they determined that if it weren't for the harm reduction efforts in Peoria, we would be seeing an extra 8 to 10 fatal overdoses per month.
Wow.
Without these interventions in place.
And that's a pretty stark statistic when you're talking about this isn't just a statistic, right? These are people's lives
Absolutely.
That we're talking about. So a very important conversation that we're having here tonight, a conversation that's not going to end tonight. It'll be a conversation for many months and potentially years to come as well. So we do want to thank you all so much for being here. We greatly appreciate your insight, your knowledge on this matter, and being willing to have this conversation. So thank you so much.
Thank you.
And we will have a quick look at the forecast with Chris when we come back, so don't touch that remote.